You head outside, many people suffer serious allergic reactions from insect bites and stings. So how do you treat that? Well, Dr. Villacis is here from the Austin Diagnostic Clinic to give us a little more insight on how to handle that, especially with children.
Oh yeah, right now. This time of year, it's so hot here that nothing pollinates here. So from an allergist point of view, we don't see a whole lot of allergies as much as we do other times.
Yeah.
But we are seeing a lot more insect sting allergies this time of year. And in fact, I've been seeing about 3. I saw 3 these last 2 weeks.
Yeah, and you said fire ants.
Fire ants, yeah, they're the most
vicious.
common. Oh, they're awful. They're very aggressive.
Yeah.
And what happens is they sting you, and when they sting you, they leave a little bit of venom in you, and all it takes is one for some patients.
Yeah.
And within minutes, some people start having a severe allergic reaction to that.
What's the worst? I mean, what happens to people when they're stung?
So it usually happens within the first few seconds of the sting, or within the first few minutes, and the symptoms can be anything from significant itching all over the body, hives, lip swelling, tongue swelling, throat swelling, cough and wheezing, nausea, vomiting. Could be quite a few things.
Yeah,
and very dangerous.
It sounds like an allergic reaction to peanuts. Some people have that severe allergy.
Yeah, absolutely, very similar symptoms. And it's estimated that about 6 million people in the U.S. have this, and unfortunately, about 50 to 100 people die in the U.S. from insect sting-related anaphylaxis.
Now, what should you do if you notice that you do have an ant bite? Sometimes you don't notice it until after it's happened and your body starts going through the reaction. So what can you do at home?
Unfortunately, most stings and most bites, nothing happens. I mean, most people do well. But again, what you're looking for is, as soon as you get stung, is you should wash it away, get away from the area if you can, and then watch for symptoms of those reactions. Usually the first thing that you'll notice is itching all over. And if that ever starts happening, that's when you should start. Of course, if it progresses, you should get yourself to an emergency room.
Is there anything that people commonly have in their medicine cabinets that could help before you get to that point of going to the emergency room?
The first inclination, of course, is to try to take something like an antihistamine, like Zyrtec or Benadryl or something like that. And that stuff works, but the problem is that's not going to work for a good 20, 30 minutes. I mean, these reactions can be a lot faster, to the point where, I've had patients within 2 to 3 minutes have a severe life-threatening reaction. So the best recommendation is that if you think you're allergic, you should see your allergist, be tested, and then they'll prescribe you what's called an EpiPen, which is an automatic injection that you should give yourself in the event of a severe allergic reaction.
I've got one of those. And bee stings too. People are allergic to bee stings as well.
That's right. And here in Texas, it's the wasp. I mean, we don't see a whole lot of honeybees. We don't see a whole lot of yellow jackets here. They're here, but you don't see a lot of them. It's the wasp that usually gets people. And the wasps are the ones that are kind of hanging out underneath your deck and under ceilings. They have that honeycombed kind of hive.
Well, if you need to see Dr. Villacis this summer, you can certainly call him at 901-4002, or you can also make an appointment by going to adclinic.com, and you can also find information there too at their website. Thank you so much.